My name is Jason Taksey. I grew up in Columbia, Maryland. I became an oncologist because I really wanted to find a field where you could get to know your patients really well and just really provide a great service to people. For me, it started when I was in undergrad. I did research at the National Cancer Institute, so I really got the chance to see early research into some of the therapies we use now, and got to develop a scientific interest in it. When I went to med school, I just really liked in oncology that it was one of the fields that you really got to know your patients well. You got to spend a lot of time with them, and it felt like you really got to provide a great service and help people through some pretty difficult times. As an oncologist, I think that the most important thing that I can do when I first meet a patient and their family members is to listen. Everyone has different goals in life, different concerns, different symptoms, and I think it's critically important that we listen so that we can tailor our recommendations to each patient's individual needs. I think the greatest thing about Maryland Oncology is that we are a community practice. We live in our communities. We're often treating our friends and neighbors, so I think that we're able to provide more personalized care. We can give the same quality of care often as a university setting, much closer to home. I look at my patients, as they often are, as friends and family, and so I care about their outcomes. I want to be part of the process with them to help them through what can be a difficult time. I think what I like about urological cancer, so take prostate cancer as an example, which is the most common of those cancers. First, it's a common cancer, so there's a lot of need. So I like being able to treat something that there's a lot of need for. With Maryland Oncology, I think it's a group of physicians, nurses, and other medical staff that really want to be there to help our patients in our community do the best they can with an often tough diagnosis. So I think it really is a joy for us to be able to be a part of our community and help our community members.